Alright, so for we're moving on the drugs that we are actually discussing. That's antibiotic drugs that we're discussing. So the next one, which will be picking up to actually talk about, the drug, basically its uses and its pharmacology, is this bacitracin. So you can see the bacitracin, you can see the ointment. Okay, to tell you that you also have the topical one. Okay, it's even mainly topical. So for the pharmacology of the bacitracin, we said that it's a polypeptide antibiotic. Okay, so it's primarily used in treating topical skin infections. When they see something is topical, yeah, the infection is just on the skin. So if you just rub it on the skin, it should be able to deal with the bacteria. So it has a lot of activity against gram-positive bacteria, and it's minimal systemic absorption. Okay, so it can just act around the skin, so you are sure that the drug will not take some undesired effects into the system. So mechanism of action is it actually targets the bacterial cell wall, so it interferes with phosphorylation of the bacterial. That's a lipid carrier that is very nice for the cell wall to be formed. Understand? So at the end of the day, it will make that the cell wall is not being formed properly. Okay, so this can lead to the cell death of the bacteria. So it is bactericidal. It will cause the death of the bacteria. Okay, so absorption is poor, so that's why you actually have to just apply it directly to the skin. Distribution is just on the skin, so there's no systemic involvement. So metabolism is through the liver, but it's minimal. Excretion is mainly renal. Okay, half-life is short, so also varies depending on the route of administration. So specifically, it will be effective against infections caused by Staphylococcus aureus, Streptococcus pyogenes, Clostridium species. Okay, so it can cause some allergic reactions. Okay, applying it on the skin sometimes can have some burns, reactions to it, rashes, itching, contact dermatitis. Then if you use it in the system, it can be nephrotoxic. Okay, so that could be one of the reasons why they actually apply it directly to the skin. So clinical use is used in treating minor cuts, burns, abrasions, skin infections, ophthalmic infections, that's eye infections. Okay, systemic use is rare. Okay, just mostly applying it to an intact skin.